Hello, I'm Pedro Mora with Pacific Media, presenting today a protest rally against the decisions made by the Vancouver Island Health Authority, referred here as VIHA. You will hear from both the healthcare workers as well as the Health Authority Board of Directors. And when you're ready to participate with your opinion, NowPolling.ca is here to count your initiative. The results of this poll can be used to pressure our government for the social changes you want.
I'm here today to protect public lands for future generations. I founded an organization called Lands a few years ago to stop the sell-off of public school lands across BC, and now I find myself calling it Let's Agree Not to Dispose of Seniors. I offer the example of Oak Bay Lodge and Mount Ptolemy Hospital being sold off. These two fine, affordable public facilities rest on public lands. Lands that were dedicated to future generations, not just our generation. No one disputes that buildings need renewal from time to time, but that is no excuse to sell the lands, and it is no excuse to privatize the care. Funding cuts are forcing health authorities to make short-sighted decisions and sell off properties. And let's put this responsibility where it belongs, with the province. The Liberal government is underfunding health care, and health authorities are desperate.
VIHA has not received any cuts in funding this year. In fact, VIHA received $94 million of additional funding in the current fiscal year. And that, operating dollars, and no, VIHA also received very significant capital funding this year to allow us to take forward a number of projects, like the new emergency department at the General Hospital. We received capital funding substitution for the PCC Centre. So we've actually done very well. So I think it's only right that we make it clear that there have been no cuts this year within VIHA.
So since 2002, the BC Liberals have frozen capital funding for health care. So VIHA is forced to sell these lands. But selling public lands for short-term cash is an unsustainable business model and will not solve VIHA's budget problems. If they do this, the Liberals will just say, oh, you have enough money, and they'll just cut more. VIHA says they'll sell Oak Bay Lodge and Mount Ptolemy Hospital to Baptist Housing Society and that the society will operate the facilities. We are told they are not for profit. But independent living costs double at Shannon Oaks what it does at Oak Bay Lodge. An independent living unit at the lodge makes money. And naturally, this is a zero-sum game. No business person in their right mind would sell off their assets and lower their net worth, not unless they wanted to destroy the very foundations of their own wealth. I've seen these tactics before. First, you undermine public confidence in perfectly sound, recently renovated buildings. Then you undermine confidence in public health care by cutting it, and then you persuade everyone that it would be better if it was privatized. And we are not fooled. We are already at least 500 beds short for seniors' care on the South Island. VIHA should be keeping these facilities and building another 400 beds. This whole deal is poorly planned because there will be no more beds after this than there were before. We will be losing our land and excellent public care for nothing.
At each meeting, the committee also reviews the status of major capital projects, and VIHA currently has 2 major capital projects underway. The new patient care center at the Royal Jubilee Hospital in Victoria, of course, is number 1, and the renal unit at the Nanaimo Regional General Hospital. And both of these projects, I can report, are currently on time and are on budget. Well, they are on time and they are on budget. Twice each year, the committee looks at a broad set of performance measures linked to its strategic goals, and the Finance Committee was satisfied with the overall performance of the measures that are in our area, with the one exception that the equipment depreciation index is not within acceptable range. depreciation rates are accelerating because of increased technology in the healthcare field, and VIHA's management is exploring strategies to target the replacement of patient care equipment and looking at strategic procurement opportunities so that we can maximize the return on the dollars we spend on equipment funding. That's my report, Mr. Chairman.
Thank you, Michael.
2 years ago, Cowichan Valley had a pretty good working system for seniors needing long-term care, and Cowichan Lodge was part of that system. It was publicly funded and operated. It had a great reputation. It sat in a semi-rural area with acreage. It had a family atmosphere. People were very satisfied. But we needed more residential care beds. Well, VIHA contracted 160 residential care beds to a new facility called Sunridge, owned and operated by a private company. And as Sunridge prepared to open, each of the residents at Cowichan Lodge was asked, "Wouldn't you like to move to that nice new place?" Well, they all declined. VIHA asked for the numbers. Who wants to move to Cowichan Lodge in an email? And they got a 0 back. They assumed it was a typo. Asked for the explanation. No typo. Nobody wants to leave Cowichan Lodge. Well, a few days later, they announced the imminent closure of Cowichan Lodge. Pushed for an explanation, Mr. Waldner said, "I have a contract with that company, Sunridge. I'm renting 160 beds from them, and I can't not honor that contract." He had no respect for the relationship the Cowichan Valley had with Cowichan Lodge, a public facility. Eventually, Cowichan Lodge closed. All who had declined the move were moved, and a lot of them did go to Sunridge. So what's happened since then? Well, in less than 2 years, Sunridge, in financial trouble, pink-slipped all their employees. Money trouble is a common theme in P3s. Mr. Waldner has publicly promised that the level of care in private facilities will be the same as in public ones. Well, I personally told him about New Horizons and Campbell River. They hired staff to honor the VIHA model of care, but within a few months of opening, they laid off most of the RNs. Were pretty expensive, you know, financial trouble already. Well, he promised to look into that. Then we have Lodge on 4th. Another P3. They were in trouble within 6 months of opening. They knew they shouldn't be laying off direct patient care, so what did they do? They reduced their kitchen staff. These cuts hurt us all. Then a staff member went to the dentist. Imagine her shock. She was informed she no longer had a dental plan through Blue Cross because the owner couldn't afford the bill. So we see a real pattern, P3s in financial distress. So what does VIHA do? What can VIHA do? VIHA cannot afford to let these P3s close. If they go bankrupt, where are they going to put all these people? They have embraced this model, and they have to support this model, and we, the taxpayer, have no knowledge of how much money of ours is going to support the P3 model that's supposed to be saving us money. Because it's a business deal, and we don't get to see the books. Add that to the last big news earlier this month of Kevin Falcon. We're going to call them convalescent patients, and we're going to charge them $29.40 a day. Talk about user fees.
And it was absolutely abominable what VIHA did to the people in Cowichan Lodge and the people who work there. People were in tears. People lost their lives earlier than they needed to. This is a terrible situation that's driven by a faith-based conviction that privatization is the answer to all the problems that our communities face. I think VIHA does have a plan. I think the BC Liberal government has a plan, and that is to auction off and privatize the Commonwealth of this province at the expense of every single citizen. And
we're here to tell VIHA that they have to adequately fund the Comox Valley. They have to provide the support services prior to hospital admission so that seniors can stay in their homes. They have to provide the funding for the acute care beds in the hospital, and they have to provide long-term care beds in our community.